Namaskar. I, Yogaasanas Sajan Sharma, working as a yoga instructor in Pedong BPHC, Kalimpong, in one of the NPCTS project coordinated by CRU Homeopathy Siliguri under CCRH Ministry of AYUSH. As Ministry of AYUSH is focusing on the theme AYUSH for immunity. So, on that regards, they had laid down three pillars, which are Ahar, Vihara and Nindra. Ahar means nutrition, Vihara means exercise in the form of yoga, in the form of pranayam or in the form of dhyan. And Nindra means sleep. As last month, in the month of September, we had celebrated Nutritional Month, in which we had discussed about fresh fruits and vegetables which an individual should consume. Together, we had discussed on nutrition diet related to pregnancy as well as in the lactating mother. The vital nutrients like protein, vitamins, fats, minerals, carbohydrates and water, which I discussed with a small number of people. We were called up in the clinic and led them about what foods and vegetables should they consume in order to develop the immunity and in order to stay healthy. So on this particular month, in October, we are celebrating Vihara, like it means exercise in the form of yoga, in the form of pranayam, in the form of dhyan. So today, I being a yoga instructor, I would like to instruct you some of the exercise or some of the yogasana which every individual should perform in order to stay healthy. So starting with the exercise, first we need to first loosen our joints and muscles like rotation of shoulders, isn't it? Like rotation of head region, rotation of your hip region, like rotation of your ankle, rotation and the movement of your toes, etc. So, without doing that, I'm directly focusing into asanas. So, firstly, we'll be doing Tadasana. So, listen to my instructions. First, interlock the fingers of both the hands, place it on the head, and when you breathe in, try to lift your body and stand on your toes. So breathe in, hold the position for a while, concentrate in one particular point and make sure all the body parts are stretched and your arms are touching the ears. Hold your breath for a while and then release and then go downwards. You should practice this asana for 3 times and you should maintain a hold of around 15 to 30 seconds. It's very much beneficial in order to develop concentration power, in order to loosen your joints, in order to maintain a proper blood circulation, and in order to protect from any digestive elements. Second asana which I'll be doing is Padahastasana. Padahastasana. You first place your hand in this manner, breathe in, breathe out and go downwards. Catch hold of the leg, go downwards, try to touch your knees with your forehead. Again, lift your body. Again, breathe out and go downwards. This asana is named as Padahastasana. You should try to touch your knees with your forehead, and it's very much beneficial for any digestive problems. It's very much beneficial for your hamstring muscles. It's very much beneficial for your knees, etc. So make sure pregnant women should not perform this asana, and those having some operation in the recent month, like it's been around 3 to 6 months, should not perform this asana. So thirdly, I'll be performing Janusir asana. It means you should touch your knees with your forehead. Your other legs should be on the green region of the reproductive part and other straight. Yes, you breathe in, you breathe out and go downwards. Try to hold your thumb and the little finger. Try to make sure that the elbows touches the ground. Go downwards. Again, breathe in and then breathe out. It's very much important in order to build your lungs capacity. It's very good for your arms, it's very good for your shoulder muscles, it's very good for your hamstring muscles. It stretches the ankle. It's very much important in order to remove anxiety, in order to remove obesity, etc. Those having severe back pain should not perform this asana. And from the other leg, you should try this again. Breathe in, breathe out, go downwards. Try to catch hold of your thumb and the little finger. Go downwards. Try to touch your knees with the forehead. Again, breathe in. And then breathe out. Make sure pregnant woman doesn't perform this asana. This asana is very much good in order to relieve constipation, etc. And thirdly, I'll be performing Naukasana. Lay down on your back. Straight. Lift your leg portion. Breathe in and lift it upward. Breathe out and take your body upward. Hold it for a while. Again, breathe in and take it downward. Breathe out and take it downward. This particular asana, named as Naukasana, is very much important in order to remove any ailments related to your abdomen region. It's very good for your liver, it's very good for your kidney, it's very good for your digestive tract, etc. And this can be done even by that. It's very good for diabetic patients. And number 4, I'll be performing Salvasana, step-by-step process. Lay down in the prone position. Yes. Make sure your palms are below the thighs and place in a downward motion. Yes. First, you lift your left leg upwards. Hold it for a while and then release it. This asana is very much beneficial in lower back pain, in sciatica problems, and it's very good for your leg muscles. Breathe in, take it upwards, hold the breath for a while, and then release it. This is number 1 posture of Salvasana. The number 2 portion of Salvasana is lift both the legs together. In case if you're having a severe back pain, you should not perform Salvasana with both the legs. Breathe in and take it upwards. Hold for a while and then breathe out and go downwards. Now, number 3, Salvasana. Number 3. Catch hold of your wrist with the other hand. Yes. Breathe in and lift your upper portion of the body. Breathe in. Hold for a while and then release. This Salvasana number 4 position. Number 4 position we'll be doing. We'll lift both the upper portion and lower portion, just keeping the stomach region on the ground. Breathe in, breathe in. Hold for a while and then relax. So I'll not be able to do all the asana related to immunity, but I have shown some of the important asana which a person should perform. Now only one of the asana, Mandukasana, which is very much beneficial to all the important organs which you have located in the middle of the stomach, like pancreas, spleen, liver, and digestive tracts, etc. And Mandukasana is very much beneficial for diabetes patient. Make a hold of the fist. Yes. Place it in this manner, inside of the navels. Yes. Breathe in. Breathe out. Go downwards. Try to look a bit forward. Hold for a while. Breathe in. Again, breathe out and go downwards. This asana should also be performed for 3 times, and we should hold the breath for 15 to 30 seconds. So as this week we are performing Vihara month, which means exercise in the form of yoga pranayam or dhyan. In the next upcoming month we'll be talking about nindra, which is sleep, which is very much important in order to live a healthy life. See, all these 3 things, ahar, vihar and nindra. Ahar is nutritional diet, good food. Vihar means good exercise, which we need to perform it daily, yoga. And third is sleep, which is very much important in order to live a healthy life. So whenever, like, sleep is one of the most important things in order to develop immunity, in order to develop ojas of the body. So every human being has a different time mentioned for sleep. For example, like a newborn baby should sleep for minimum 14 to 19 hours, isn't it? So a baby who is above 3 to 5 years should sleep for around 12 to 14 hours. Like an adult should sleep minimum for 8 to 10 hours, and a person who are above 40 should always maintain a healthy sleep of 6 to 8 hours. So I complete my video here. So I wish you healthy life and healthy living. Thank you so much.